Good afternoon and welcome. Thank you for joining us for our training, Tools for Creating Calm in Times of Distress, Part 4, hosted by the Center of Excellence for Behavioral Health and Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder trainings to nursing facilities nationally at no cost to the nursing facility. And now I am happy to introduce our presenter for today, Mr. Matthew Rosa. Matthew is a licensed clinical social worker, consultant, and founding member of NIATAC. Matthew provides training, coaching, technical assistance, and planning support to universities, research studies, governments, and health and human service provider organizations. Matthew's current areas of focus include evidence-based practice implementation, process quality improvement, staff and team development, and a wide array of training topics. I'll now turn it over to Matthew to begin the presentation.
Thank you, Nikki. I appreciate that. And thank you, Derek, as well. It's good to be with all of you today. And hopefully some of you have had the opportunity to be a part of our previous conversations, and we'll welcome you back today. We're going to be spending some time talking about motivational interviewing and using some particular motivational interviewing related skills as a way to engage and manage situations where folks are experiencing some distress, and to explore how to use open-ended questions specifically, which is part of those OR skills for motivational interviewing to help you, in addition to some other ideas that we'll be exploring today. We do have a new opportunity today. We're going to be doing some breakout sessions, some simple breakout sessions. And before any of you get concerned about what our expectations of you will be, simple, clear, focused opportunity to just have a little interaction around a particular topic. I'll give you instructions when we get to that, which I think will be helpful for us as we think about how you can use some of these skills in your own environment. So rest assured, it'll be a real manageable expectation that we'll give to you that will be simple and easy and hopefully enjoyable as you get a little chance to interact with some of your peers today. Okay, so coming back to our original orientation of what we're doing here, we're engaging individuals within your care environments. They may have some mental health needs that are substantial. They may have some significant distress. And how do we pivot to manage those so as to be able to get back to the broader mental health care, the broader care that's required for those individuals? What are the tools you need? How do you then save time by using those tools so that you can then be able to manage your day-to-day care tasks within your environments? We're going to continue to have this spirit of motivational interviewing as we talk about these issues, thinking about people rather than behaviors, trying to avoid judgment for any problematic behaviors that might create challenges or stressors for you in your environment or for your peers or for other residents or for the individual themselves. Who they are versus what they do, thinking about avoiding the stigma or the judgment related to the individual and helping them to think about these things from a strength-based perspective, strengths, hopes, and dreams, positive frame as we address issues of distress. So remembering this idea of ambivalence that we've been talking about previously a little bit, that we're all ambivalent when we're trying to make decisions, especially if there are decisions of any significance. And that if we use certain tools, reflective listening and some other tools that we'll explore a little bit, that can make a dramatic difference in helping people to consider their own struggle as they make decisions about issues of significance and about simple decisions in the moment related to what they're doing or what they might be hoping to do. So one quick question, and you can use the chat to do this. I want to have you give us a response to this question. What level of certainty, what percentage of certainty do you have for most of the decisions you make? And let's think about decisions that are bigger than what you're going to have for lunch or for dinner. I mean, those sometimes are significant if you're going out and you're picking a restaurant, but let's think about things like, I use examples like, should I buy a new car or not? Should I join the gym or not? What level? In 50-50 is like, oh, flip a coin, I'm not sure what to do. What percentage do you require? Do you have to get 60% certain, 75%? Do you have to get 90% certain before you'll make a decision? What's required for you if you're trying to decide, whether or not you should do something that may be a little bit significant for you? What do you think? I have a couple of responses here. So we got a 75 and a 50-50. So Amber's kind of in that flip the coin situation, whereas Tina, on the other hand, requires a very high level of certainty, right? I didn't have the write-in option for you to say like 100%. Probably most of us would agree we don't really usually get to 100% with most things, right? Uh, Janice says 80%. Yeah, I think a lot of us are in these neighborhoods. We all recognize that there's some level of ambivalence about everything that's significant. Think about all the significant choices that you make. We're never 100% certain. That's just the nature of the human experience. So I appreciate some of you sharing your own experiences in that regard. So that's just a universal truth for us all, that's kind of how we do things. We are often in this situation where we have to weigh pros and cons, and that's where that decision balance that you see here, which is used a lot in motivational interviewing, helps us to kind of think about decisions. What are the pros? What are the cons? Notice the inverse questions on the pro side. What are the pros of doing the change? What are the cons of not doing the change? I think there's some advantages to me joining the gym. I think there's some cons of me not joining the gym. Advantages are I'll get fit. Cons are I won't exercise as much, or I won't be motivated because I won't be around other people who are exercising, and that tends to help me to exercise. Just as an example. Cons of the change, well, it's going to cost me money. It'll take time. There'll be maybe some things I won't do because I'll be doing that instead. What are the pros of not changing? Well, if I don't join the gym, then I will have more time to do something else that I like to do, or I'll have more money in my pocket. So this is kind of how we all tend to think about changes, and it's helpful to sort of put them on a scale like this. And often when we're trying to help people to make decisions, this is what we do, help them to explore the pros and the cons. We know what happens. Think about for yourself what happens when we're trying to convince someone that they should do something. There tends to be this kind of tug of war that can unfold. And there's this idea of dropping the rope that you may have heard someone talk about, rather than trying to pull someone toward a particular decision. What if we didn't do that? What if we dropped that rope and did something else instead? We're going to explore that a little later when we get into the breakout opportunity that we want to share with you. What's it like to try to convince someone to do something, to try to pull them toward a certain direction? And what's it like to drop that rope and just kind of sit with wherever they're at and help to try to understand what they're experiencing? These elements really relate quite strongly to the motivational interviewing four kind of core processes, right? Where we work to engage people, help to focus them, help to evoke some change, and then to do some planning related to whatever that change might be. And so if we think about those four areas, we start out with engaging, and we use these ORs: open-ended questions, affirmations, reflections, summarizing. These ORs are the kind of core foundational engagement strategies when we're trying to help someone who is trying to sort through a particular challenge. Sorry about that. Didn't have a chance to get to the mute button. Might sneeze again. Hopefully not. So ORs are critical to that process. And then we focus, try to help to understand what it is that the person might be trying to achieve in that moment, right? Once we've engaged them with that empathic, open-ended questions and reflections, we try to understand what their needs are. If you're working with someone in your environment, perhaps a resident who is stressed and struggling with something, once we've established that engagement, let's try to focus on what it is that is the concern, what it is that they're concerned about, and what they might be able to do to work with you to address that or resolve that. And then we think about evoking and considering ways that they might be able to change or make a decision, again, We all are ambivalent about making changes and decisions, but we use these acronyms of darn cat. Darn is, do they have a desire, ability, reason, need to change? Is there something that they can do to help themselves, to support improvements for themselves based upon whatever it is that might be causing their distress? And these cat, it's darn cat. Cat is, do they have a commitment? Can we activate and help them to take steps toward change? And we always try to keep these open-ended questions in the mix when we're doing this part. And then planning. Once we get to that stage, we've really engaged, focused, and evoked some change thinking and change talk and activated them toward change. Then we do some planning. This is kind of the easy part because all the hard stuff has already been done. Okay, so we know what we want to do together. Let's think about how we can do that, how I can help you to do that, how you can work with that individual to support them in doing what it is that they want to do. So we also use these ORs on the back end. We use them on the front end and the back end and pretty much all the way through. The ORs are really very fundamental and foundational to this kind of engagement with folks. And if someone is distressed, we use these open-ended questions. We affirm them for their sharing. We reflect back to them what we're hearing from them. And we try to summarize the story or the sequence that we're hearing from them to help them to feel more organized about it. Particularly important when someone's highly distressed, because in that moment, they might find it hard to manage their thoughts. They might find it hard to organize their thinking or to retain some clarity about something that's maybe a little more complicated, like a relationship issue with someone. So summarizing really helps them to get a better sense of their experience. Reflecting back to them lets them see their experience with a little more clarity, which can in and of itself, right, reduce people's distress that they're experiencing in that moment. So with that as our foundation, we want to do a breakout with you. So here's what I'd like to do. Probably going to do this. Maybe we said 5 to 10 minutes. We'll be in the neighborhood of like 7 minutes. I'll pick 7 minutes as our time. So here's what we're going to have you do. We're going to break you out into breakout rooms of 5 per room. There's just random assignments of all of you into these rooms. We're going to ask one of you now start thinking about this. One of you to volunteer right out of the gate. Try to just do that quickly. Just have somebody volunteer right out of the gate to share a significant decision that you're considering, right? Something that's not too personal, something that you're comfortable sharing. Like I have some examples, what car to buy, whether or not to take a class, what color to paint your living room, something that's, I think, significant. It's meaningful, but it's not personal or really huge. We want to keep it at a level that's manageable and where we feel comfortable with the disclosure and the conversation. So think of something. Everybody think of something right now. What's something that you're considering, right? Something that you're considering doing. And then I want the one person to say, okay, I've got something that I'm going to share with you. Here's the thing that I'm considering, right? So I'm considering taking a class I'm considering going to a yoga class. I've never done yoga before. That could be one for me because my wife just went to a yoga class and said, you should come with me. Okay, so I'm thinking about whether or not I'll go to this yoga class. Then I want everyone else in the room. There'll be 4 or 5 other people. I want you to work to convince that person to choose a particular option. I'd like for all of you to line up behind the first person. So if it's the class, and the person says, I'm not sure whether I should take the class, and the first person says, yeah, you should absolutely take the class because, and then I want everyone else to weigh in the same direction. Yeah, I agree. You should take it because, and then the next person, yeah, I think it's a good idea because, and I want everyone to line up and try to encourage that person, convince that person that that is the correct course of action. So that's what we want to do. Any questions, put them in the chat if you have one, about what we're going to do as a breakout experience. So one person agrees to describe their decision. I'm thinking about doing X. And I'm trying to decide about this, and then everyone else is going to gather together and say, we think you should do this, all right? And then we're going to leave you in that room for about 7 minutes, and then we're going to come back together and we're going to talk about that experience. So try to move right into it quickly. The one person, just raise your hand right as you get to breakouts, and then we'll see what it's like when you come back. Right? So everyone else just kind of try to get them to do that thing that they're thinking about doing. So Derek, I think we're good to go ahead and put people into the breakout rooms.
Okay, that message has been sent. You can go ahead and accept the room. If anyone has not moved to a room, let me know if you're experiencing some type of technical issue. Get into a breakout room.
I'm noticing Derek Aaron describing a challenge in the breakout room in the chat.
Looks like Aaron made it to room 3.
Maybe we could give them another minute or so, Derek, and then bring them back.
Sixty-second countdown.
Okay, Derek, so it looks like we have our rooms closed and we have everyone back with us. And I appreciate everybody doing that exercise with us. I'd like to take a minute to get a little bit of feedback. And if we can have you unmute and share, that's really the best way for us to have this chat, I think. You can use the chat as well, but optimally, it's really good to hear from people out loud if we can. So here's what I would like to do. I'd like to hear from the people who were the individuals who shared their decision, shared the issue of concern, the thing that they needed to make a decision about, the thing that they were weighing, and to have that person tell us what's it like to have the other people trying to convince you, trying to give you different reasons why you should do a certain something. Let's just start there. What was it like? What was your experience when people started to tell you to do a certain decision or to make a certain decision or to take a certain direction with whatever the issue was? And as I said, if you can unmute and just tell us just a couple of thoughts about what that was like, that'd be great. Let's start there. What was that like for you? And feel free to just unmute as opposed to being called upon by raising of hands. It's good to just hear what your experience was. How
We
did
have
that go?
a comment in the chat.
Yes, thanks, Nikki. Deciding if I wanted to move to a bigger city or not. I like the feedback. They agreed that it was a bigger city would have more experiences in it. Okay. So, Allie, I'm curious as to whether or not um, if you were to think about your current motivations to move to a bigger city, if it was on the decision balance, how much of you is on the I want to move to a bigger city side versus I don't want to move to a bigger city? What's your current weight on that one? Do you have a current waiting? I mean, how motivated are you to do that? Is it pretty high? I'm kind of guessing that it might be because you kind of appreciated the feedback and the encouragement in that direction. Amber said, I was deciding on whether to take yoga teacher training to offer to our patients. Okay, a decision about whether or not to do yoga. So Allie was saying about 50-50 right now because your family lives in where you are in the same city right now. Oh, okay, you live where your family is right now. So that would be a pretty significant downside if you were to make that change. So the group was saying, you should move. Allie, you should move. The city is going to offer you some, or excuse me, yeah, you should move because the city is going to offer you some significant opportunities. I'm wondering, okay, so we also had Allie talking about this 50-50. And I'm wondering, Amber, what it was like for you, because you're saying that the feedback was positive for you. It helped me to lean toward taking the class. All right. So I'm curious if you could unmute, that's always great because then I can have a little chat with you about this for either of you. Were there any points in the process where you were kind of hearing it in a way that that created any reactions for you other than sort of the purely positive side? Was there any other kind of experience that you had as they were encouraging you? Go ahead and unmute. Let me know.
And Allie doesn't have access to her mic.
Oh, thank you. Yep, very good. Appreciate that. How about you, Amber? Do you have access to your mic? Oh, okay. Doesn't have audio. Thank you. Okay, so we'll just go ahead with the chat. That's perfectly fine. So what we're noticing here are some pretty positive experiences. The people in the room said, hey, we think you should do this. Yeah, that's a good idea. We think you should do this. And their experiences were relatively positive. So can you, all of you who are participating with us, think about what that's like if you were engaged with, say, a resident in your facility and they were trying to decide whether or not to do something or whether kind of challenged by some situation, and you were to take a similar approach to what we're describing here, which is to say, I think you should do this. And someone else on the staff said, yeah, I agree. I think you should do that too. What's your sense? Do you think that that person would have the same kind of a response that we see here from our participants? Amber and Allie saying, yeah, it was positive. I appreciate it. It actually was sort of reinforcing and supportive. That's kind of the sense I'm getting from them. What do you all think would happen if you were having the same approach with, say, residents within your facility? If they were distressed about something and they said, I'm frustrated, I can't decide what should I have my family member visit, or how should I talk to them about the fact that they didn't visit, or whatever it might be. And you said, well, here's what you should do. You should do X. And your other staff person who's working with you said, yes, I agree. You should do X. That's the thing to do. How would that be? How would that feel? What do you think would happen? How would they respond? Any thoughts? What's your sense of that? Maybe you've had this experience.
Hi, this is April. I would think it really depends on the situation and the resident, but I don't think it would always be positive because then you're not forcing them, but you're kind of interjecting your opinion and what you think they should do and not letting them, decide for themselves.
Yeah. I think that's very, very well and clearly stated. Thank you for that. That was April, right? Am I right?
Yes.
Okay. Thank you, April. So back to that tug of war kind of scenario we described with the motivational interviewing concepts. If we say, yes, you should do this, yes, you should do this, the person might have a bit of a pullback reaction, right? A reaction because they might feel controlled. Right? Your intentions might be perfectly positive as you're trying to be supportive of them, but they might, in fact, feel like you're telling them what to do or trying to control them. By trying to convince them. And so there's a certain power dynamic to that conversation. We didn't see that in these conversations here. What do you think is the difference between these conversations and the one that April is describing, given the scenario we set up with a resident? How are those two things different? Anybody have a thought about that? why is it that our 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 simple exercise results in people feeling quite positive about it, whereas there are certain scenarios where we think the resident would not feel positive about it, might have a power control dynamic. And as April said, it might depend on the issue and depend on the person. What do you think would be the difference that might create that more negative experience on the part of the resident? What's your hunch about that?
I would say sometimes, not always, but sometimes people don't always speak with residents on a peer-to-peer level.
Okay.
And so things might come across as you're trying to control, the situation, telling them what they should do instead of maybe helping just give them options and then letting them decide for themselves.
Yeah.
That would be one of my thoughts.
That's an important thought, April. If we think about the power dynamics in our exercise, all of you had an equal felt sense of power, right? And if you were suggesting an idea that you needed to make a decision on, and other people were saying, "Yeah, I think you should do that," or "Yeah, I don't think you should do that," whatever it is, you really don't feel any obligations. The power dynamic is really not anything that would be threatening or concerning. Whereas with residents, that might be different. Right? The power dynamic could be significantly different, where the person could perceive the staff as having power or control in the environment as the staff within the facility, and the different roles that the staff and the resident have. And that could very much change the way they perceive your encouragement or your advice giving. And it might not then be perceived as you being helpful. It might be perceived as you trying to be controlling of their decisions or to take power away from them. I think April has a good analysis of that. Anybody else have a thought about that in terms of what it's like for residents if you might try to tell them, to encourage them toward a certain action? If they say, "I don't know if I want my daughter to visit me," and you were to then say, "Well, yeah, you should definitely have your daughter visit you," or on the other side of the scale to say, "Absolutely, I agree, you shouldn't have your daughter visit you." What's your sense of that in terms of the dynamic with people? How will they respond when you do that? Anyone else have a comment or an experience related to that? It's always good to hear those. I think that April's comments are really helpful as we think about what that power is like for people. So let me ask you a question, and you can put a number in the chat for me. For those of you who were sharing your decision, when people were asking you that question or giving you the feedback, which one do you think applies to your situation? Did their feedback make you much more likely, somewhat more likely, no more likely, less likely, very much less likely to select that particular option that they were encouraging? How did you respond to it? Just give us a number if you were the one who was sharing your decision. What was the influence of the feedback in the room for you? How did you respond? I see a 3, and I think I see another number. Just looking through our chat, looks like I have 1, 3. Anybody else have a response? What kind of a number you would give that from your own experience?
We have a 1.
Yeah, and that kind of makes sense. Oh yeah, much more likely. I didn't see the 1 after Amber's comment. Thank you, Nikki. Thanks for that, Nikki. So yeah, so much more likely, and it sounds like in that case they were really supporting what you were thinking about doing. Allie was describing it as pretty neutral, didn't really have much of an influence. What do you think it would have been like if you were leaning toward one thing and the group decided to encourage you toward the opposite? Be interesting to think about that dynamic. In that case, we might get into some of those tug of war situations. Like, I want to I want to join the health club. I think that's good for me. And then the group says, no, that's not a good idea. It'll be a waste of money. You probably won't go very much anyway, so it won't be worth it. Then you won't have time to do some other things. It's really expensive. Are you sure you want to spend that much money on it? I mean, is it really going to be something that's going to improve your health? I mean, you could just go for a walk instead, and that's free. As you hear me say that, if you're a person who wants to join a health club, what's your reaction? How do you feel as you hear me line those things up? Anybody have a response? How does that feel to you? What does it do on this list for you? Does it make you more likely to say, forget it, I'm not going to join? Or does it make you say, oh, I'm definitely not going to follow this advice. I'm going to go ahead and join that health club. We all have different ways of reacting to these situations. But often when people try to pull us, we set our feet in and we tend to pull back, particularly if we feel like they're trying to pull us strongly toward a direction that we have not decided we want to do. We're very ambivalent about it. So this is a pretty common situation. So here's what I want to do. I want to have another breakout session, but we're going to do something different this time. Thank you for those of you who shared. I'm going to ask different people to share this time, not the same people, because they already contributed in a substantial way. So thank you for doing that. So let's have somebody else switch it up this time. And we're going to do something a little different. In this case, we're going to have a different person share something that they're thinking about doing. Some choice that they're making. Similar situation, could be anything like the examples. These were great examples that we had in the first round. And then we want the other people in the room to just ask open-ended questions. And if you remember what open-ended questions are like, why do you want to do that? How do you think that that will benefit you? What is it about this that's important to you? Can you tell me more about this decision? What led you to kind of to this spot where you're considering these options? Why do you think this is important right now to make this decision? Right. So these are all open-ended questions. Remembering open-ended questions are the questions that have any number of wide answers. They are the opposite of yes/no questions. So we want you, after the person presents their decision, to just start to ask them open-ended questions about it, and to just kind of take turns and ask them a few, and they can answer them. Of course, that makes sense. You're having a conversation. And again, we're sticking with kind of lighthearted decisions, not particularly personal things. So it should be relatively easy to have a little dialogue about this. And we'll spend a few minutes like we did last time, probably say, maybe 8 minutes or so in this breakout, and then we will have you come back and we'll see what that felt like. So I think Derek's going to go ahead and put us in those, and we'll go ahead and have the experience. Actually, let's stick with 5 minutes. I think, Derek, 5 will be good for this, to just have those open-ended questions and have someone right out of the gate come up with your decision, somebody different, and then the others can start asking you those open-ended questions.
Okay, a message has been sent to join the room. Rooms will close in 60 seconds.
Out, you know.
All right, so I think we've gotten people back from our breakout rooms. Thank you for coming back with us. Now what we want to do is to talk for a minute about what the experience was like with the open-ended questions. So for the people who shared their decision that they're considering, and then people started asking you open-ended questions, I'd like to hear from you about what that felt like. What was it like to have them answer those open-ended questions? Did you learn things or anything? Did it move you further away from or closer to clarity about the decision? What was that like? What were those open-ended questions like for you as people asked them of you? Give us a little bit of feedback. If you want to unmute, that's great. We'd love to hear it with your voice. That's helpful. But if you're not able to, based upon your environment, you can certainly use the chat. So what was it like to be asked those open-ended questions? It made me think more deeply about the why, said Deb. Yeah, about the why, right? Kind of helped you, when people ask you, well, why do you want to do that? It was kind of pushing you to explore your thinking a little bit further. So yeah, that makes good sense. What else? Anybody else? What was your experience like as they were asking you those questions? Did it change the way you thought about the issue? Feel free to tell us what the issue is and how it might have shifted your thinking when they were asking you why questions. Did it move you closer or further away from a decision? What do you think? So Shanika said, it felt pretty good to have people share their interest in what and how I was thinking of ways to better my relationship with my patients by taking painting classes to allow them to express their artistic side. Yeah, so this is a really important comment, Shanika. It felt good because they shared their interest in what and how I was thinking. I appreciate that comment. When people ask us open-ended questions, it really is, just as in Deb's comment, why? I want to understand your thinking, how you're considering this. Um, it really does feel good when people ask us those kinds of questions because it's a real focused attention on who we are and how we're thinking about something and what our thoughts are related to it and what our plan is and our experience of it. So they're really curious and engaged in considering who we are and what we're thinking and what our question or our decision is. So yeah, it's generally really very supportive, and it makes you feel good. I think that's pretty universal when people do experience open-ended questions. Any other comments from the people who experienced it? What was it like for you to get those open-ended questions? Feel free if we have another party who wants to share, if we have anyone else. So here's what I also want to think about with you for a minute. For those of you who are asking the questions, what was it like to just ask open-ended questions? Was there any part of you who wanted to just tell them what you thought, yes or no, good idea, bad idea? Did you want to just sort of give advice? What was it like when you were asking the open-ended questions? How did you feel when you were doing it? Any thoughts? Again, feel free to unmute and share it and or use the chat. What was it like asking open-ended questions? How did you feel doing that? sometimes people report that asking open-ended questions is kind of hard work, because we start to realize that we ask a lot of closed questions. And so we often don't do open-ended questions. So Amber is saying, I wanted to learn more about painting class. So you were curious about what it was because Shanika was planning to do the painting. And so you were curious, it made you more interested. Yeah, when we ask open-ended questions, we tend to become more interested because people are interesting, right? People are interesting. So once we open up the dialogue, we get more curious. Like, yeah, this is interesting stuff. I want to learn more about this. Shelley shared it. Seems like I was convincing myself or not rather than them. Yeah, so that's interesting. So as I'm kind of exploring and asking those questions, I'm framing up my own, it's changing the way I'm thinking about this. So I'm learning too, not just from what they're saying, I'm just learning and thinking differently from asking the questions, which I think is a really good point. So these open-ended questions can be very powerful for either party. Shanika said, I felt empowered to learn more about how the activity could happen. Yeah, appreciate that. It's empowering because it starts to get you to explore. And when we were talking about change talk with motivational interviewing, when people become more activated, when we're engaging them and they start to consider change, that's empowering and it's activating and it actually gets you moving forward, right? Okay, so you start to operationalize how you would do it, what you would do, and that's why they're so useful, right? They engage the person, you're connecting them around some of these ideas and getting them focused on how they might actually move forward. So these are all really good reflections on the power of these kinds of questions. I thank you all for asking those. So here's another quick question to think about. If we think about the experience of considering and asking open-ended questions, what's your thought? Is it easy? Does it take some thought? Is it hard work? Just put a number in the chat if you want to when you think about focusing on open-ended questions. Are they easy to do? Do they take some thought? Is there some challenge? Are they particularly difficult? One of the things you can learn about your own style is how easy is it to do open-ended questions. If it's relatively easy, my guess is you do it pretty regularly. Some of us tend to be more, particularly some jobs and some roles where you are kind of telling people what to do, giving directions, giving guidance. Your role is more about fixing and doing. And so you don't tend to do as much in the way of open-ended questions. And Shelley's comment's a really good one. It does depend on the topic. With certain things, the open-ended question feels really comfortable and really easy to do. So that's a really good point. Appreciate the dialogue. These are really thoughtful comments and reflections about what the experience is like for you. So when we think about using these open-ended questions, remember that you can use them with everybody in every situation. You can use them with residents, with family members, with your coworkers. They're really effective and powerful in any number of different circumstances. And to Shelley's last point, depending on the circumstance and the question, they can be more or less intense in terms of the emotionality or the thoughts and feelings that are brought up by open-ended questions, and they're always helpful. It is a great example of that pivot we've been talking about. When someone is distressed, to take that moment to just connect with them, to engage with them, to not try to fix, but to just take a moment to reflect and see what we can do to better understand by asking open-ended questions. And most likely what we will do is we will help them to move toward some decision-making, some next steps without a power struggle or a power dynamic that's not healthy for you or not healthy for them. So that's really the core of our exploration today. I really appreciate you all doing that. Do we have any questions, comments as we wind down for today?